Yep.
Alright, sex. The one word a teacher could say to get the class to giggle. I remember when I first heard it, it was funny. But today I'm going to talk about sex and try to persuade you all to practice safe sex. And what is safe sex? According to Planned Parenthood, safer sex is anything we do during sex play to reduce our risk of getting a sexually transmitted infection. I would also include unexpected pregnancy. That's something you don't really want. Today I'm going to talk about contraceptives, STDs, and unexpected pregnancies, the cost of it. According to the American Health Association and PregnantTeenHelp.org, each year 1 in 4 teens contracts an STD. More than half of all people will have an STD at some point in their lifetime. Every year, around 750,000 teenagers will get pregnant, and that leads to 24% of all unmarried expectant mothers. To prevent pregnancy, there's many ways. There's contraceptives, there's condoms, birth control pills, morning after pills, cervical caps, dental dams, patch. There's the pulling out method. Females, you can get your tubes tied, and males, you can get a vasectomy. All of them help reduce the chance of getting pregnant, but not a lot of them help the chance of not getting an STD. Some of the incurable STDs that are out there are hepatitis B, genital herpes, HPV, and HIV. Some curable ones with just some simple medications are chlamydia, crabs, gonorrhea, hepatitis, scabies, and syphilis. Just a little bit about some of them. According to Planned Parenthood, chlamydia is the most common STD in the United States. If it goes unchecked, it can be a problem. It could reduce sterility in men and can reduce the chances of women getting pregnant if they want to have kids. But if you go to the doctor and get checked, it's just simple antibiotics. Gonorrhea, also known as the clap or the drip. It's dangerous because a lot of the STDs, they don't show a lot of symptoms at first, and you can just go on and not even know it. But some of the symptoms are fever, painful intercourse, and a yellowish discharge. That's pretty disgusting. And most of these ones can be just fixed with antibiotics. Pregnancy, unexpected pregnancy. I had a friend actually in high school. I was a junior and he was a senior, and he ended up getting the girl pregnant, and they ended up having the kid. And for unexpected teenage mothers, it kind of sucks because they kind of stop what they're doing. They can't really go back to school until after the baby's taken care of. But as soon as he graduated, he went straight to work, and he works a lot. He works hard. And even with my little brother, I have a little brother that's 8, and he's a oops. But dude, babies are expensive. They really are. I don't know how underage people can afford it without help. I was looking on the Planned Parenthood website, and mostly, if you look at all the STDs, it said mostly that condoms are the way to help really reduce the chances of getting STDs. They didn't really mention any of the other ones. They just said mostly condoms. But a way that we can all prevent getting STDs or pregnancy is abstinence.
All right, Stephanie, what did you think?
It was good. It's funny. You had a good intro, the whole sex thing. things. That was good. Got my attention like right away. The sources about like Planned Parenthood, that was good. You kind of read a little too much, and because of that, it was a little awkward because you would like talk about like gonorrhea and stuff, and then you just like paused for a sec, and then it was like kind of awkward. But then you saved it, so it was good. It was short, but it was really good. So it was interesting.
All right, well, the topic area is pretty well clarified. The attention device is okay because it's that well-known bit of humor. I'm not exactly sure what your goal is. I know what the topic area is. What is it you're trying to convince us of, especially that we don't already know or believe? Are you trying to get us to take a particular action, wear a condom or engage, use safe sex practices or actually refrain from sexual contact? That's not really set up as the objective of the speech. It seems to be implied during some of the presentation, but like I said, I didn't think that it was structured into the presentation. I thought you set up a structure at the beginning of the speech that was going to be relatively clear, but as you got into the material, you seemed to be bouncing all over the place, back and forth between STDs and contraception, especially in the first part of the speech. In the later part of the speech, I think you have a couple of examples that are kind of, make some emotional appeals. You talk about your friend who has a kid who, and he's, had to go to work and it's changed his life, and you can kind of visualize a little bit the impact that it would have on a woman who's having a child at a young age. I think you need to develop those kinds of things a little bit more. The casual reference to your younger brother, well, what's the impact that that's had, and is that a consequence of failure to be adequately prepared, or just a failure of the preparation to work effectively? I don't think you want to have that conversation with your parents. It's probably something that you won't be too comfortable talking about. The presentation, I think you use your voice pretty effectively. When you look at the audience, you do talk to us, but there are times when you don't look at the audience. You're going through this whole kind of brochure kind of inventory of here are all the STDs, and you seem kind of disengaged at that point. You've got vivid facial expressions, and you're making a point. I think people kind of appreciate the oops comment and the joke that you have at the beginning, but it needs to be in service of some purpose, and I think that is the thing that's most missing from your presentation. All right. Thank you.